Hello, everyone. My name is Mary Samuel. I work in the HSCP National Health and Social Care Professions Office. Thank you for taking the time and joining us today. You're very welcome to the fourth session of this webinar series hosted by the National HSCP Office in collaboration with Institute of Leadership, RCSI. The theme for the series is HSCP Leadership in Practice During COVID-19. And in today's session, we are going to focus on the area of service user empowerment. We are joined by an expert panel consisting of Ms. Jackie Reed, Ms. Paula Marr, Dr. Maria Gomes, and Ms. Sinead Keogh. It's my pleasure to introduce the panel members. Jackie is the national lead of the National Health and Social Care Professions Office, and she has kindly agreed to facilitate the discussion. Paula is an occupational therapist who has been working within the area of mental health, both in community and in acute services. Paula has a keen interest within areas of mental health promotion, service user empowerment, early intervention, overcoming barriers to community integration, and in promoting personally meaningful lifestyle changes. Paula recently presented her research on addressing sexuality within mental health practice at the annual AOTI conference. We are delighted to have Sinead with us here today, who's going to share her experience from service users' perspective. She has been working with St. Vincent de Paul for the past year and enjoys craft and art in her spare time. Thank you, Sinead, for being with us here today. Maria is a clinical psychologist with over 25 years of working in disability services with children and adolescents. As part of a multidisciplinary team of experienced clinical professionals, Maria has huge experience in working with young people with autism spectrum disorder and their families. She has presented and published several papers in the area of ASD. Without further ado, I'll now hand over the session to Jackie. Thank you, Jackie.
Thank you very much, Mary. Paula, if I may talk to you first. Thank you so much for joining us today. Could I start by asking you a little bit about how your service adapted to COVID-19?
Yeah, so at the time when COVID, I guess, became a thing in Ireland, I was working on a community mental health team as an occupational therapist. So the role of OT within kind of a mental health community service is very much around promoting engagement in occupation, trying to reintegrate people back into the community and provide them with those skills, which all have been shown to have a positive influence on well-being. Prior to COVID, all groups were always face-to-face, and there was a real emphasis on groups in regards to information sharing and promoting those skills for kind of reintegration into community. But because of COVID, all of the groups were suspended, unfortunately, indefinitely, and I guess there was a sense of nobody really knew what was kind of coming, and nobody knew when groups would be able to return face-to-face. So we wanted to look at, I guess, what are the needs of our service users at that time, and try to create a group that would be able to, no matter what kind of level of restriction, would still be able to go on. So then what we did, I guess, was we were kind of looking at the service user needs at the time. So there was a lot of need. So we looked at kind of their reports that had been done, and kind of from interviews with the service users that we were already involved with, to try to identify what they would be interested in doing. Which turned out that there was a real interest in kind of a creative occupation. So we want to try and promote that as a service user kind of, I guess, interest. Unfortunately, at that time, video groups weren't really up and running because of GDPR issues. And also a lot of our service users identified a barrier within that. So a lot of them wouldn't have access to computers, which would obviously limit their engagement within it. So we want to look at something that would be readily available to the most service users. So therefore we looked at photography and creating an online photography group through email, as we found that most service users had phones, smartphones, and most service users had access to email. So therefore it will be something also that no matter what restriction was kind of put in place, it would be something that they would be able to engage in.
So, Paula, can you tell us then a bit about what you did set up, and with that photography group, and how it worked?
Yeah, so one of the main, I guess, things we were looking at is to try and find a group whereby all the services could be involved, and no matter what kind of level of restriction, they'd still be able to go. And also, a lot of our service users would experience physical comorbidities, so we really want to protect our service users while enabling them to still continue with their journey to recovery. So we did interviews with our service users, we looked at their files to identify if they've had an interest checklist, which would identify their interests and hobbies. So from that, we got a lot of ideas around the idea of setting up something creative. Then we had to look at, I guess, what our resources were. So from a service perspective, there was very, very limited resources. So at the time, it was the start of the pandemic, we didn't have access to video kind of groups, and also actually our service users wouldn't have had personal laptops, so some of them wouldn't have. So that would be a kind of a barrier to that. So then we kind of explored it a bit further and looked at the evidence around kind of creative groups, and participatory photography came up, which is the idea of taking photos and sharing experiences within photography. So we also incorporated the aspect of gratitude into that. So a lot of people are more visual than kind of auditory, so the idea of kind of using a photo to like develop that kind of sense of gratitude. So doing things like, say, like one of our themes of the week might have been around something that I enjoy doing, or something that makes me happy, makes me smile. So we want to incorporate that gratitude in. So then how the group worked practically was an email was sent out every week, saying on a Wednesday about a theme of the week. So within that, we kind of did a lot of pictorial kind of examples to give people inspiration. And then what we do is we'd give them a week to take the photo and send it in with a reminder on a Monday. And then in the next theme of the week, we would send out a collage of all the photos the participants took on that previous theme of the week.
Sounds really, really interesting, Paula. And you mentioned there are already some challenges around technology. I was wondering, is there any other things that came up as you were doing that were proved to be challenging or you had to overcome?
There was actually, when we kind of were doing our recruitment, so we did our recruitment a few different ways, through staff themselves asking service users, and through our service user newsletter, so service users could kind of ask to kind of refer themselves. And we found that 2 service users actually didn't have emails and had no interest in creating an email account. So I guess we wanted to work with them, and I guess that equity of access was really important to us. So what we did was, with those 2 service users, they had WhatsApp, so we actually remotely helped them basically do the photography group through WhatsApp instead. Also, there was a few service users that had literacy difficulties. So when we were creating our themes of the week, we ensured that we had a lot of pictures within our email, so that even if they had struggles reading, they were able to kind of, I guess, get some sort of idea from the pictures. Also, I guess from a kind of practical perspective, we were worried about confidentiality, so we set up with an email account just for groups, with kind of, I guess, a sign off just to say, just for them to know that that's not, that email address won't be monitored, and for if they needed help, we put a little helpline down and our own service contact number.
Thanks very much, Paula. And I'm wondering that's really interesting how you overcame those challenges. What kind of feedback did you get then, or how's it been going?
Yeah, so there was definitely increased uptake, and a lot of people had identified photography as a new hobby that they had. Also, I think a few weeks after our photography group ended, the HSCP released, they were doing an online photography exhibition. So there was 1 or 2 of our service users that took part in that. Also, a lot of service users identified that they were leaving the house more often, and felt a lot better in themselves, which was great. Also, a lot of we promoted that the team had gotten involved within the photography who were taking photos. So there's a sense of increased team morale within that, which was great. And actually the group was very popular, so it was actually started again within our service. And we kind of shared our information with our colleagues kind of within our sector, but also within Ireland. And there's been a few OT photography groups that have been set up all over the country, and I've got really good feedback from them too, which has been lovely.
That's really interesting. So, and it's interesting to hear the feedback from your colleagues as well. Was there any particular learning that you take from that whole experience?
Yes, so I guess I actually took part in the photography group myself. So the idea was that when we had the collage, that nobody knew who was a service user and who was a team member, and I guess it gave me insight into maybe like the barriers that can be to participating in a group. And like there was one week and I forgot to send in the photo, and there was a sense of anxiety around that. And I guess knowing that we're putting myself in the service user's shoes and really seeing actually, it's kind of hard to remind yourself to be in a group and to take part at times. So that was a big learning curve for me. Also, I guess I didn't realize, but kind of reflecting back maybe on the face-to-face groups, sometimes it can be very much the clinician is telling the service users what to do, but in this group there was a bit more flexibility within the within kind of what the service users had a lot more control, because they were the ones taking the pictures and it was what was important to them and they were sending it in. So I learned kind of about maybe trying to create a group which is a bit more of a collaboration rather than an education piece, kind of a one-sided education piece. Also kind of maybe aware of, like, I guess a lot of service users had reported since the pandemic are loss of occupation, a loss of hobbies and interests. A lot of people wouldn't have been doing anything, and I guess how that can really have a big impact on somebody's well-being. But yeah, it also made me kind of aware of from a service user's perspective, how I guess the pros of an online group. There was one service user who had never attended face-to-face groups as it was too overwhelming. So that an online group can be a good, for someone with quite maybe severe anxiety symptoms, it can be a good stepping stone into kind of that kind of group social context in a very safe environment for them. The cons are obviously sometimes, I guess it was hard to get that sense of connection. That's one thing I learned. It's through kind of an online platform, it can be a lot more difficult to create that sense of connection and kind of information sharing. So I think going forward, it'd be helpful to have maybe groups that incorporate both into it.
That's really interesting. Are there any other particular things that you do differently if you were going again, or you've mentioned that there's more groups?
Yeah, so I think when we did it again, we made sure that, because we felt that yes, there was 2 service users that said, oh, I don't have email, but we'd like to participate. But we presumed then from that there was probably a lot of other service users that said, oh, I just can't. So we made it very clear in our next when we were doing the group next that both options were open to everyone. I also probably would have maybe kind of done, so let's just say there was 10 service users, I probably would have done like maybe one little session in between, like one-on-one, to try and kind of see what barriers they were experiencing at taking the photography, whether it be skill-based, motivation-based, and then maybe at the end of the group, how to apply those skills of structure, organization, because they had to send the photo in by Wednesday. So how to incorporate those skills they learned into their everyday life. So in about kind of other ways. So I think definitely maybe a bit more group work and one-on-ones would have been helpful. And also, I guess, maybe more service user involvement. So service users coming up with more themes themselves to kind of promote that confidence building.
Thanks very much, Paula. And just finally, just yourself, like just in terms of the leadership, and obviously a lot of leadership in setting this up and getting it going. And I suppose just from that perspective, like what have you taken in terms of the leadership experience from this that you'll carry forward or you'd like to share with others?
Yeah, so I think the aspect of, I was kind of at the start of the group, when it was first being created, it was very much for the service users. And then, you know, I started thinking about the team and, you know, the team morale and how that can influence our own kind of practice. So that kind of aspect of getting the team involved was really important, and that aspect of kind of promoting staff well-being. It was something definitely I learned. Also, I guess that idea of trying to incorporate the service users more into the group was a major thing, trying collaborating and trying to identify kind of what suits them. So the idea of, I guess, the sharing the vision policy of kind of engaging stakeholders as equal partners. Also, I guess, as a kind of, you know, developing my leadership skills, I learned maybe to meet people where they're at, and, you know, the importance maybe of continuing with online groups that some people would find other groups too difficult, and trying to meet people, okay, maybe that they want the one-on-ones, or trying to identify actually what do they need and how can I meet them where they're at, and how can I help them overcome any barriers that they're experiencing. One of my own things though, I identified that, I guess, yes, like obviously I did the group, you know, I created the group, but like I do have a manager who's really empowers me to be creative and empowers that sense of kind of, you know, trying to innovate and support me. And I was able to call her up and be like, I'm thinking about this, what do you think? And the same with my supervisor. And I guess that having a service, and in fairness, the team were great too for, you know, being open around creating a photographer group. So I guess leadership, you know, I feel like my leadership skills were kind of, I guess, helped by the team around me, which is a big learning curve.
Yeah, no, yes, it's all very important, isn't it? Your own leadership and other people supporting and encouraging that as well. So thank you so much for sharing all of that with us, Paula. It's been really interesting. I now think we're going to have the opportunity to speak to Sinead, to have that perspective from somebody who's had the experience of using the group and participating in the group. Thank you so much, Sinead, for talking to us today. I wonder, could you tell us a little bit about your experience of that photography group?
I loved it because I got to see how other people think and how other people see, you know, like the world through their eyes. So I was learning like the way other people think. Like, I don't know, everyone looks at the same flower but sees it different in their eyes.
It sounds like you really enjoyed the group. Why was it important to you?
Yeah, well, it was important to me because it also learned me how to be patient, because like I'd love to see other people's photos, but obviously I'd have to wait a week to see their photos and they'd have to wait a week to see mine. Yeah. You know, so I kind of learned to be patient, and I wasn't seeing friends. So I was kind of by myself all the time, and like if you're looking at the same 4 things every day, you're going to get bored, and like I lost motivation sometimes, like, you know, to get up and get out. But with this, it kind of gave me a reason to get up and get out, to see like there's a local park across the road from me, and I never usually go in, but sometimes the teams were like, say, flowers, or there was something to do with water, and over my local park they have a fountain dedicated to the Stardust fire. So I was able to go over and take pictures of that, because I thought, well, with the anniversary coming up, I can go over, you know, have it mixed in with that. Like, you know, and while I was out taking the pictures, then I was meeting people. Like, I probably never met them before, but we'd stop and have a chat just about the most random things, but I was having that interaction with another human being.
Thank you so much, Sinead, for sharing that. And I'm wondering, do you have any other thoughts about why groups in mental health are important for people?
Yeah, I think it's very important, because a lot of people might see one person from the start of the week to the end, and then they're constantly on their own and they're constantly thinking negatively, and you know what I mean? And then obviously if they're thinking negatively, then things are going to spiral out of control. But at least if they're doing a group, they're kind of linking in with each other, you know what I mean? Like, you'd make friends and I don't know, you'd email them or you'd meet them for a cup of coffee after the group. You know, so you get a connection, you make friendships and stuff like that from doing the groups.
So, Sinead, I'm just wondering from what you're saying there, are there particular skills that you learned from this group?
I have, yeah. I've learned to be confident. Like, before I did any of these groups, I was very nervous. You know, like even going to the till or something, buying something, or I'd be kind of looking at the ground or whatever. But now, like, since doing these groups, I've got my confidence are super high. Like I'm even now working for the St. Vincent de Paul, you know, in their shop, which I would have never done a year or two ago. I would have been terrified in the public. But now I'm interacting with the public face to face every day. And I'm learning new skills and my confidence is going up. And yeah, I love it. Like I'm even able to make eye contact with people. Up to a few years ago, I was terrified to look people in the eye, but now I'm able to sit there and have like a full-blown conversation without looking down to the ground or looking away. Now I'm just, yeah.
Thank you very much, Sinead, for sharing that with us. And now you've successfully done a webinar as well. I don't know if that was a new experience or not, but we're really do appreciate you taking the time to share that with us, because it's really valuable and very interesting.
Thanks. I enjoyed meeting you all as well.
Thank you so much. Now I'd like to move on to speak to Maria, who is a clinical psychologist in St. Gabriel's service in Limerick. Thank you so much for joining us, Maria. I wonder if we could start, if you could give us a little bit of an overview of your service.
Okay, so thanks for having me. So I am a clinical psychologist at St. Gabriel's Children's Services, which is based in Limerick. It is one of 6 children's disability network teams in the Midwest that provide a range of family-centered intervention services to children from 0 to 18 with developmental delay or some form of a disability. So that's pretty much our service.
Thank you very much, Maria, for telling us about your service. I wonder if you could tell us a little bit, give us an overview of the program then that you're running, the specific program.
So the program is a parent program for parents of children that have received a diagnosis of ASD, in relation to their children. The program has been developed and it's run by 3 different clinicians. So Patrick Hines, who's an occupational therapist, and Fiona Woods, who's a speech and language therapist, and I'm the clinical psychologist. So I'm obviously here representing my colleagues as well. The program caters for parents, as I said, of young people aged 6 to 18 who have received a diagnosis of ASD, of autism spectrum disorder. It comprises of 6 sessions, 2.5 hours each session on a weekly basis. And then at the end, there's 2 additional sessions that serve as, review sessions at a later stage, sometimes 2 to 3 months later. We go back and we meet with the parents again, and we review some of the things that we had covered in the previous initial sessions, the 6 sessions, and we ask questions, they ask questions, we have discussions, and we review some of the things that we had discussed, including, a number of strategies that, were provided and the parents did try to put in place. The main goal of the program is to empower parents of children with ASD to support and maximize their children's potential through the use of the most recent evidence-based research available for the treatment of young people with ASD and their families, such as parenting coaching, and through a transdisciplinary team-based approach. So the program was created by the 3 of us, as I mentioned earlier, although it was adapted by other standard programs already, that are being used. but in a way that is more sensitive to the Irish context and to the local situation in terms of resources available, in terms of clinical intervention and educational services that we have, let's say, in Limerick County or in the Midwest. We also believe that some of the positives of this program is its ability to adjust to different age groups in terms of the children, its ability to cover a broader amount of topics, from motor skills to language development, behavior, sensory issues. So we believe it to be more comprehensive. It's flexible to meet the goals set by the parents in terms of their needs and their children's needs during discussion, during the program. The program is key in forming early stages in a care pathway for children and young people with ASD, but also as a treatment model of intervention in later stages of childhood and adolescence. And finally, I suppose there is a growing number of children being diagnosed with ASD. I think it is common knowledge at this stage. And obviously, we are faced with very limited resources. So parents we see them as the main carers for children and young people with ASD. They are key in their children's educational and health development. Therefore, once trained to implement intervention strategies throughout the day in their natural environments, in both, it is both, time efficient and cost effective. So I think that's one of the big things about this program.
So, thank you so much, Maria, for giving us an overview. Obviously, an important program for families with children with ASD. I'm wondering, obviously, COVID must have had a big impact on that, and I'm wondering, how you might have had to adapt in the context of COVID, and maybe what positives or challenges came out of that adaptation.
So obviously, we were faced, and I think, Paula just described a number of challenges and I suppose benefits as well. So I'll start with some of the benefits. One of the main benefits was actually the fact that we were able to still deliver, a service to a large number of parents of children, because especially during the first lockdown, we didn't really know what to do. We pretty much all stopped everything that we were doing. And then suddenly we kind of realized that we could actually go back to, to finding a platform suitable and to deliver, a service once again. So that, from our perspective, was one of the benefits. Obviously, we saw other benefits as well when we started delivering the program to the parents and having discussions with the parents. And we found that some parents actually found the program online to be more friendly, especially to the ones that find, the face-to-face group situation uncomfortable or intimidating or anxiety-provoking. So it was a more comfortable way to interact with some parents. They're less exposed as well. It also works better for families that may have, child and care transport difficulties, which we often, have. Some parents are more comfortable in their own home, so that's another positive. And we do have sometimes parents that also travel for work-related purposes, and they would not be able to attend a face-to-face program, but online they were able to attend the program just the same. So I think those were, the main benefits. In terms of challenges, obviously, we find it more difficult to, we miss out on the face-to-face connection and the interaction with people. The group is always, a small number of parents, usually no more than 10 to 12. So when you're face-to-face, obviously, we do engage in a more a richer discussion, let's say, and we were missing out on that. Obviously, we also missed out on having visual information available around the room that we often have that support, the discussions and the strategies provided, and also not being able to share materials that we often, do to illustrate again the, solutions to problems presented and discussed. So, we did miss out on, that not just the interaction of one-to-one, but and the group as a whole, but also in the materials that we have and that we usually use, while we're running the programs.
So thank you. So that's really interesting, the mix of the positives and the challenges. And I'm wondering now, as you reflect back on having been through that, in terms of kind of leadership learning or things that you might take forward from that, or that you might share in terms of leadership learning with others, what kind of things might come up?
Okay, I suppose, I suppose due to COVID restrictions, we have also identified the need to be more flexible in the future by delivering the program, probably both, face to face and also online, because yes, we did find a cohort of parents that do prefer the program to be online because, again, they're more comfortable, they don't have to travel, it's probably less anxious for them. But obviously we also have the other cohort of parents that prefer, the one-to-one interaction, that rather come into the clinic and be with us and participate in a group setting that is, I suppose, a little bit more friendly, than talking to a computer. The program is in line with a family-centered approach that is widely acknowledged in evidence-based research and in the national policy on access to services for children and young people with disability and developmental delay, which was published in 2016. So obviously that. We have been, slowly moving, because we have been running this program, the three of us, for the last 6 years. We have slowly been moving from an interdisciplinary way of working to a more transdisciplinary approach, which stems from, obviously, a lot of trust developed amongst ourselves over time, feeling very comfortable as professionals with each other, trusting, one another. I think trust is major. It's absolutely major in a good relationship within, a team of professionals. But it also helps build the confidence that, the parents have on us when they see that we are comfortable with each other. And I suppose also we've been getting a lot of feedback from parents and young people. We keep modifying the program to suit the needs identified by the families, so by both the parents and the children. And we actually recently, interviewed a number of parents and a number of young people in relation to the program, and to see what do they feel we should focus on. And I suppose, the parents identified pretty much 4 things that we thought were very interesting. I suppose one was that they do get a better understanding of what autism spectrum disorder really is, and the impact that that has in their lives and their children's lives, not just in the present, but in the future. They believe, or they report, that they are more skilled to work with their children in relation to their behavior, sensory and communication difficulties in everyday life. They are better skilled to adjust to adjust their own environment at home in terms of visual information, in terms of structure and routine. So that was another benefit highlighted by the parents. And the last one would be that their interaction with other parents and how they share different experiences, they found that very, very enriching, was probably one of the biggest benefits that most parents identified. So again, when you're face to face, you have that connection more than when you do have it online. But yet the parents did identify that connection as being, a very rich experience. In terms of the young people, we also interviewed 10 young people, and basically so they were ages 12 to 19, just so you have an idea. And we pretty much just asked them what they felt their parents should know or understand better about their autism, and what would help them in their everyday life. And the young people actually identified 3 things. Number 1 was that, that their parents understand and manage better their own emotions. So, the young people's emotions in terms of when they display with anxiety, with fear, with sadness, with extreme happiness, so that their parents would be more able to understand their emotions and how they display those emotions. Secondly, they showed an interest that their parents would have a better understanding of making them as young people more independent, okay? Because, this was a very interesting, point, because parents do tend to be overprotective. I mean, we're all overprotective of our children, but when, your child has special needs, we probably go a little bit, maybe too far sometimes. And it's interesting to see how young people also have that awareness, and they would like that to change, and they would like their parents to allow them to be more independent. So that was also something very interesting that they highlighted. And finally, the third thing that the young people highlighted was that their parents and other people would be able to understand when there is a need for them to be by themselves. We have this idea that, we have to encourage young people to be more social and to be around other people. And yes, they are able to learn that, and they are able to, manage that, but they also feel that sometimes they do need to be by themselves, and that people, mostly their parents, need to understand that sometimes they actually do need to be left alone. And that alone time is really crucial for them to even self-regulate. So we were, we found the feedback from the young people very, very interesting, because it shows, that they do have quite a level of awareness of their own needs and what other people have to understand about their own needs. So, it was quite positive.
Thank you very much, Maria, for sharing that. That's really powerful feedback from the young people and their families. Very, very strong messages there. I was also very struck by what you said about trust and relationships, and that helping the transition in the way the team worked as well to transdisciplinary, and that and the impact for the families. And I'm just the final question, just wondering then about there's a lot of richness in what you shared there, and I think you mentioned some publications. I'm just wondering, can you tell us a little bit about where that might be being shared, whether conferences, publications, presentations?
So to answer your question, yes, we have been trying to share our experience with other professionals, particularly, colleagues that work in the area of disability with children and families. We have shared our experience in terms of these groups with other teams within the Midwest. We have also published a few articles, namely in the HSC Health Bulletin. If people are interested, and if they find the bulletin online, there's a number of articles that we have published, not just on the parent program, but also on diagnostic assessments of young people with autism spectrum disorder and how to provide them with intervention. Also on the care pathways, because as I mentioned earlier, we do believe that it is, these programs are quite crucial and they're the first step in our care pathway for intervention of young people and their families with autism spectrum disorder. We have presented in a few conferences. We actually presented in the last 2 Progressing Disability conferences that took place in Mary I here in Limerick. So the last one was actually, I believe, in December 2019, right before the pandemic. We just submitted an abstract to the AOTI conference, which is going to take place in Paris in 2022. So, you know, we are constantly adjusting and we're constantly trying to improve the program. We're trying to share it as much as possible with other people that share an interest in this area. And I think that would pretty much be it.
So thank you so much, Maria, for sharing that with us. And to Paula and Sinead, I'm now going to hand back to Mary to sum up and conclude. Thank you, everybody.
Thank you, Jackie. Usually at the end of the session, we collate the key points and the leadership characteristics that have been demonstrated in the work that has been carried out. In this session, as I was listening to Paula, the main leadership characteristic that stood out really clearly is the way she responded to the challenges presented. She really took the time, thought it through, did not react, but rather respond appropriately. This response is against to reaction led to innovation. She also put herself in the shoes of the service user, and this helped her to understand the challenges better. She was keen to deliver the services, but worked applying the principles of empowerment model, thereby making the best out of the situation. She saw the potential to turn a limitation to something that could grow dynamically. And this was clearly voiced by Sinead when sharing her experience as a service user. Thank you, Paula. And moving on to Maria's project, I first want to acknowledge the efforts of their team, Maria, Patrick, and Fiona together, what they have achieved this far. I want to focus on the component of team stability, the concept of interdisciplinarity, and particularly how it has benefited the service user. It is very evident that they started working as an interdisciplinary team, where they integrated knowledge and methods from different disciplines and synthesized an approach that works for them, for their service, and for the service users. What is interesting is the fact that this interdisciplinary working over time evolved itself to a transdisciplinary way of working, and how they've gone beyond disciplinary perspectives to focus holistically on the outcomes. This then leads to the question of stability within teams and the challenges of high staff turnover that we may face in some sectors and in some settings. If staff turnover is something that we cannot avoid, then is there an expectation on the leader to provide or maybe to create a culture in which this kind of transdisciplinary work will flourish? We will be asking those questions to our leaders in the system in our next webinar, and please do tune in and join us for our next session. I would like to take this opportunity to thank our panel members, Jackie, Paula, Sinead, and Maria, for sharing their experience today with us. And my sincere thanks to Tina and Miriam from RCSI in making this webinar a reality. Our contact details are displayed on the slide. Please refer to resources section for further information on these two projects. And before we end, I'm delighted to announce that our new strategy, HSCP Deliver, has been launched on the 21st of April. You can access the soft copy of this strategy on the Discovery Zone on HSC LAN, and later on our HSCP Hub on HSC LAN when it is ready. Please do take the time and familiarize yourself with the strategy. Looking forward to meeting you all at our next webinar, which will be the last one for this series. Thank you.